But
we're,
we,
we're gonna
young parents don't.
we're gonna come right back to that. We're going live on YouTube, and this is the Wisdom Table, coming to you from Grand Houses in Harlem, USA. Pardon me, I'm between shows. Anyway, once again, this is the Wisdom Table, coming to you from the Grand Houses in Harlem, USA, based on 125th Street in Grant and Amsterdam Avenue in Harlem, USA. I'm Brother Leroy, co-host of the Wisdom Table, and we're very happy to have with us one of our favorite guests, and that is Dr. Velva Bowles of Louisiana by way of North Carolina. And this program does not reflect the views, attitudes, whims, deeds, or any other proclivities of the management of the NYCHA development. Neither does the views expressed here reflect anything of the resident council of the Grand Houses. However, the program does reflect the research done by the participants live in living color and by Zoom, as you can see. Our guest, Dr. Velva Bowles, has been asked to give an insight into a number of things, primarily comorbidity, which we tend to hear in association with COVID as, oh, this person died, they were comorbid with X, Y, and Z. What we want to do is find out for that group or groupings of individuals, what would be a lifestyle, what would be a diet style, what would be a preventive style that would minimize the opportunity of COVID to take them out. Dr. Velva Bowles, thank you for joining us.
Good afternoon. In response to your question, the term comorbidity, it really disturbs me how language is used in television, newspaper, radio, and it sounds like something a bit obscure. And those of us listening, if we don't rush and define the term, we may never know what they're talking about. In medicine, when we say comorbidity, what you can think of is in addition. If I said I have a headache, in addition, I have a fever. So the word comorbidity should trigger in your mind that something is already there, and this is in addition. So if we think about that in plain language, it starts to be a little clearer. So when they say people with comorbidities are more at risk for severe illness and death from COVID-19, what they're telling you is if your body is already stressed, and this stress is because you have high blood pressure, or you have diabetes, or you are obese, or you have liver disease, or kidney disease, or stomach disease, or colon cancer. That is something you already have. And when COVID-19 infection comes along and they say anyone with comorbidities, they're saying if you get the infection in addition to, that's the first way, just to think about it in a general term. If you have anything and COVID-19 shows up, it's going to make everything worse. It's like a bad house guest. You didn't invite them. You don't want to see them. You wish they didn't stay that long. Whatever you had to eat now is half as much, and so forth. So it is an additional stressor. What we know from a clinical or I guess you say a biochemical point of view, back in February, I guess February 1st through early parts of February is when we first started hearing about COVID crossing over from China and from Spain. The people that died, particularly in New Orleans, 78% of those who died within the second week, third week of February were Black. And you looked at it, it was in Detroit, it happened. And in Chicago, 68%, 56%, Atlanta. And all of a sudden people were saying, is it just disproportionate for Black folk? And the answer is no. COVID uncovers the medical injustice of these United States. Many people who are poor, and too often that involves many Black Americans, they get substandard healthcare in these United States. And I'll repeat it, substandard. because when a Black person has a disease or a condition, let's just take diabetes, they're never really explained the whole story. They are told what they can receive. You can have metformin, you can get glucotrol, you can get insulin. They tell you we are controlling your sugar. And if they're admonished you, they're telling you you don't control your sugar well. And the reality of it is diabetes is more than just sugar. It's more than trying to control sugar. It is a condition which is considered a syndrome. By definition, if you are diagnosed with diabetes type 2, they're telling you you have a vasculitis. That's why diabetics can have a silent heart attack. You may not have any pain and you can have a heart attack, and that's death. You can go blind. That's because the vessels in the eye are affected by this condition, and they say, oh, well, that's a diabetic blindness. You can have neuropathy, meaning that sensation of ants crawling on your feet or legs, or hot and cold, or restless legs. They just say, oh, that's a diabetic neuropathy. You can end up with increased blood clots. You can end up with a slowed immune system such that you end up with a amputation if you stump your toe or step on something. Number one diabetic effects in the South for Black people is an amputation. Second to that would be heart attack. Third to that would be stroke. And because Black Americans are not availed the most modern medicines, and you say, well, what do you mean by that? There are at least 32 types of treatments for type 2 diabetes, but I just named the 3 that Black people are allowed to have. And the question said, Velva, you said allowed. Why allowed? If you're receiving Medicaid or Medicare, most primary care physicians can only write a prescription that is approved on formulary. Now, formulary is a list of medicines that a group of doctors decided. This is what poor people can have. That is your only criteria. You are poor. That I may know that if you're having restless leg syndrome, cold feet, pain when you're walking, we call that claudication. And I know there's a new medicine on that's just been released by one of the giants, Pfizer or Merck Sharp Dome, and I write that prescription for you, I will get a call and they'll say, Dr. Bowles, Medicaid won't pay for this. You have to choose something from formulary. Now, the reason I'm taking all this time to explain, I'm saying there is a huge percentage of people who are on Medicaid or Medicare and who are poor without health insurance who get suboptimal treatment for long-term chronic conditions. With that being said, when COVID-19 showed up, and a Black person who had diabetes, since we're discussing diabetes, their body could not respond the way someone who did not have diabetes. Why? They already have vasculitis. They already have different system partial failure due to the disease or the syndrome diabetes. What we now know is that when COVID affected Black people, they did not act like Chinese people. They did not act like the Spanish people. They got stomach complaints, severe pain, diarrhea. They had muscle aches. They had joint pain. So when they went to the emergency room, if you remember, if you think back to February, you did not get a COVID-19 test if you didn't have a fever. You didn't get the test if you didn't have a dry cough, because those were the symptoms that major America accepted as indication that you had COVID. And many Black families told me they took grandma or grandpa or auntie to the emergency room 5 times. The first time, nope, don't have COVID, go home. Next time, nope, you don't have COVID. So the problem here is basically racism. That you had a controlling medical establishment deciding if you didn't show the symptoms that they had approved. Notice what I said, had approved. You didn't even get tested. My medical training was you check the patient for symptoms and signs. You don't tell the patient what they have to have. You ask the patient, what is your complaint? So this was totally backwards. They didn't say, oh, I have now had 20 separate patients come in with stomach complaints and muscle pain. Let's see if this is COVID. Nope. If it were Black people with these, quote, unusual symptoms, they got sent home. So when they returned finally and were so sick that they now couldn't breathe, it was accepted. Okay, they can't breathe. Let's test and see if they have COVID. And many of them did not last 48 hours after they accepted their symptoms. If you notice when they were calling out for ventilators and respiratories, this is a respiratory disease, you don't hear that anymore, because the most recent understanding is this virus behaves unlike what they predicted. And did you hear what I say? Predicted. I didn't say what they observed, what they found among the patients that were brought to them, but where they sat back and decided this is the acceptable symptoms. And then suddenly, when Black people were dying, 78% of the deaths in New Orleans in the beginning were Black, and they started examining these persons who had died. All of them were COVID-19. Some of the real doctors, the ones who are not dictated by some establishment, said, wait a minute, let's stop. We can't tell Black people they don't have COVID-19 if they don't have a cough and if they don't have a fever. We need to stop that. So you started seeing the YouTube videos. I saw a Black nurse about February 11th or so who came on saying, I think the ventilator are killing Black people. As soon as they intubate them, they're dead. Guess what, brother? She was right. What we now know 2.5 months later is that this virus doesn't care about your lungs any more than it cares about anything else. There's a receptor, it looks like. Now, just for clarity, a receptor is like a key. When you leave your house and lock your house and go about your business, I can come to your house and try to put my key in your door, but it won't unlock your door because the door requires a specific key. Well, infection is the same way. The body has certain proteins present on certain cells, and this virus looks for a particular protein, and we have an acronym for it, is ACE-2. So we call it ACE2. And what they have found is that in Black people, ACE2 is more predominant in the gut and in the kidneys and in the heart, inside of blood vessels. So what happens when this virus comes to someone who is Black or of that genetic makeup, they will have complaints that involve the stomach, the gut, and the blood vessels. Now, I don't know what they found with the Chinese people or with those that were in Spain, but I do know that the presentation in America among Blacks was GI and then vascular. Now they're saying that, yes, that's true. The virus affects those differently. You have some who can have the infection and don't feel anything, no symptoms. Have some who have the infection and they may have just muscle aches and pain aches, a little headache. And then you have the fever, and some who will have the cough. And this is why it is so difficult to develop a vaccine for this particular virus. So getting back to your question, comorbidity. If you have high blood pressure, by definition, your veins are affected. Either they are hardening or they're narrowed with cholesterol deposit, but whatever the reason, something is going on with your vessels. Now, I just told you COVID can target vessels. So if you have a condition where the vessels are already affected, high blood pressure, and here comes a virus that comes in and attaches itself to ACE2 receptors that are located inside of your vessels, you have an additional assault. You already had one, so you had that comorbidity. So anyone who already has a problem, COVID makes it worse. And where that problem is, if there are a high number of ACE2 receptors, COVID will zone in on that. So that's why Black people were having heart attacks, increased blood clots, which means strokes, muscle pain, and severe diarrhea. So comorbidity is, just think of it as a condition already existing, and here comes something that makes everything worse. So essentially, comorbidity is in addition to.
Okay, Doc, I want you to go back over the receptors, what they found as it relates to present in the gut. You said the gut, the stomach.
Inside the blood vessels.
Blood vessels.
Yes.
Just go over that.
Okay, well, I'm glad that you want that focused on, because that's a point that needs to be spoken about when we talk about our children going back to school. The big question is, okay, if ACE2 receptors is what this virus is targeting, how do you know where it's going to show up in your body? Well, no one has mapped it yet. No one has said this particular group will have more likely a GI problem or more likely a heart attack. But what they have found in the pediatrics, this came out about 2 weeks ago, young children aged 2 to 12 are more likely to have a vasculitis. That means these healthy children with no comorbidities, this virus targets their vessels. What does that mean? It means these children will have blood clots. These children can ultimately have a stroke. Why? They got blood clots. These children can get a heart attack because of blood clots. These children can end up with an amputation because of blood clots. So the risk to the young, healthy population is more related to the distribution of the receptors. What they're not telling you, and if you listen to the news, they make it sound as if you are healthy, you get infected, you either get completely well or you die. That's not true. You can get infected, not die, and end up demented because you had a stroke. You can get infected and not die and have an amputation. One of your limbs have had to be removed. You can get the infection, not die, be on a respirator, put in a coma for a month or 2 months, and wake up and cannot walk. So the whole story about this virus is not that you either live or you die. There can be consequences that affect you for the rest of your life. And I don't know why they don't say it plainly, because I hear the people being cavalier about face masks and distancing, and it's my right and I don't care. They need to know the whole story. This virus can interrupt your life forever. You can be paralyzed. You can have a stroke. You can have a heart attack. You have amputation, depending on how the virus affects you. And we can't predict. And therefore, if they're talking about developing a vaccine, let's consider this. I don't know where your ACE2 receptors are. Maybe you have them in the brain more than you have them anywhere else. And if you get infected, you're going to be speaking out of your head. You're going to have neurological problems. You're going to be dizzy. You can be blinded, and you may never recover fully. And I come along and say, listen, Brother Leroy, I want to give you a shot. And I want this shot to act just like the virus, but it won't kill you. That doesn't make me happy, because if it acts like the virus, this vaccine can cause the same symptoms I just described. Right. So we need to know not dying is not the ultimate. You shouldn't just say, oh, get a vaccine so you won't die from it. And when you hear them saying they're rushing this vaccine, we haven't done phase 3 trials, what they're telling you is they can look for one thing. I say, okay, if I give you this shot, you will develop antibodies. And I may be an excellent scientist, and what I said is true, but it may also, this is what I just said, also cause some problem that I did not predict. And I did not know to predict it. So I give you the shot and your antibodies show up and we all say, yay, but then you become paralyzed like multiple sclerosis, or you develop lupus, or you have a neurological defect, or you get a murmur in your heart. They can tell you what they're trying to elicit, and be very straightforward with that. But if you're practicing good medicine, I must always tell you the risk. If you ever listen to TV when they're trying to get you to talk to your doctor about a certain medicine, and they'll give you this wonderful story. If you are depressed and you add this, you will be happy and you can dance with your child in the garden. And after that nice music stops, what do they say? May also cause you blindness, heart attack, paralysis, death. Well, they are obligated to tell you the good and the bad. So if they're rushing the vaccine, all they're talking about is the good, that we can get herd immunity. We can make sure that you have 11 years or 17 years of immunity, that it won't be as bad. But okay, that's a possibility. And we're smart. There are good scientists out there. But the reason they're sidestepping, and some real physicians who took the oath of do no harm are out there saying, slow down, wait a minute. What they're saying is we can elicit what we just told you, but we can't control it once we've given it to you. So this virus being as sneaky as it is, that it can attack in so many ways, the vaccine, if it's mimicking the virus, what does that mean? I'm mimicking the virus. That means whatever the virus can do, there's a possibility that this vaccine can also trigger. There are things like post-polio syndrome. There are things like post-measles syndrome. Look at chickenpox. You know, you're a kid with chickenpox, and when you get old, you end up with shingles. We know viruses can hide and come back later. We know virus situations, you know, when you say shingles, I had somebody say, I don't know, how's that guy doing chickenpox? I said, it's the same thing. It just hid out for 50 years. And showed up. And when it showed up, it just gave you the same kind of itchy blisters pain along a dermazone. Look at the herpes virus. If you ever had a fever blister, it comes, you treat it, and you feel happy. And just as something wonderful is about to happen, here it is again. Viruses can hide within our body and show up at a later date. Okay. COVID-19 is a virus.
Okay. In terms of that it can hide, what can people who fall into the comorbid category, and I'm talking about anybody that's dealing with asthma, anyone that's dealing with high blood pressure, being overweight, etc. What, if we go in category by category as much as we can, what would the asthmatic be about that would minimize the impact of COVID-19 on them, whether they wear masks, gloves, whatever the situation is? Because we're not hearing how you can build your immune system. We're not hearing what your lifestyle is impacting on your immune system. An immune system, and this is a statement question, the immune system is key to you surviving or being able to fend off COVID-19? That's a statement question for your response.
Oh, that's an excellent question. The first thing I think I want to share is there is not a single immune response. A lot of people think of it as an off-on switch. It's not. Some people respond to invasive things through what we call innate immunity, and that eventually becomes antibodies. That's when you hear about, do they have antibodies against this or that? But there is another response we have that is called cellular. And the cellular response is the one that gives long-term immunity. When the body has, let's take asthma, since you use that. Any person with asthma has generally an overreactive cell in the body called eosinophil. And we don't hear much about an eosinophil, but an eosinophil is, if you did any kind of a check on a child with asthma or a person with COPD, which is the reverse of asthma as far as breathing goes, but very similar mechanism, it is an overproduction of mucus That's why the asthmatic has to get breathing treatments. They take in epinephrine and other medications to dilate the bronchus so that the air can move back and forth. But the primary problem is plugging, that the mucus there is plugging the bronchi. In COPD is called scarring because maybe they smoked or they worked in a coal mine, or even beauticians. A lot of them don't know that women who did hot pressing of black hair inhaled sufficient sulfates and smokes, that we have some women who have COPD that white Americans never diagnosed, but I digress. So if you have asthma, you already have a problem with moving air in and out of your bronchus. So if you now, as a comorbidity, get COVID, you have a compromised airway. And the lungs in people who have compromised airways have a higher number of ACE2 receptors. You see how it gets complicated? So if I got more ACE2 receptors in my lungs because I already have asthma or I already have COPD, and COVID now starts to target that same area, I have mucus plugs because of my asthma. I have narrowed bronchus because of my asthma. I have poor oxygen movement because of my asthma. And here comes COVID doing what? Causing swelling. How does it cause swelling in the lung? If you are an asthmatic and the way in which your body responds to COVID-19 is not by producing antibodies, but by recruiting cells. When cells start migrating into the tissue, you are essentially having your worst asthma attack you've ever had. You already have a cell called eosinophil that's is active more than it should be. And then now the virus can trigger another cellular component to get reactive. You essentially have no lung capacity. It's not like your lungs fill with fluid. That's what pneumonia is. I'm telling you that your lung tissue swells. So essentially you may have a lung volume, let's say a lung volume of 1 liter, where you take a deep breath and then blow the air out. When the cells start to crowd into the tissue and the tissue swells, your lung volume may drop down to less than 1/4 of 1 liter. So if I put pressurized oxygen in there with a ventilator, I can push against the swollen tissue and rip it apart. So what have I done? I facilitated the death, because not only did I not help you with pressurized oxygen, I further damaged the tissue that was swollen. And that's the conundrum. If I can't breathe because the volume of my lungs have decreased, how do you help me? You can't force air in there, or you're going to blow my lungs out. And that's why when they're saying if you have any kind of pulmonary issue, cystic fibrosis would be a condition that would be comorbid, asthma would be a condition, COPD, the medical establishment have very limited ways they can help you. They can't give you the pressurized oxygen without the risk of it doing further harm. So some people with their comorbidity, if they come into with the condition of swollen lungs, we call it ARDS, acute respiratory syndrome, a distress syndrome. If you show up with ARDS, they really can't do much. They can put a face mask on you, which means the little area around your nose is enriched with oxygen. But if they intubate you, which is a normal response when a person's oxygen level goes down, that could really be the final thing they do. So it's a complicated disease.
So what type of lifestyle should they be mindful of? What should they be taking in? And I'm asking not as a prescription, but as in terms of remedies that you have seen implemented in the past.
Okay,
And,
so now you want me to tell you how can we help ourselves? We just talked about the helplessness of the medical profession. What I have told my dear friends, and I phoned my sister recently, who is a teacher and got to go back to class in North Carolina, and here's my advice to her. If they're telling you teachers are on front lines, they didn't give you PPE. Look at the ER docs and nurses. They're in what looks like moon suits. They're covered head to toe in these disposable jumpsuits. Teachers don't have that. Think about it. So I asked her, I said, well, what are you doing with face-to-face? And she gave me, oh, they're spacing and they're wearing masks. And I said, do this for me. I ordered rosemary oil, organic. I said, I got it off of Amazon. I'm going to tell you my source. And I use rosemary oil as a preventative. Now, let me explain. And we're going into what is called holistic medicine or Ayurvedic medicine. Any kind of aerosolized oil. I'll give you an example. If you ever used Vicks Saf, if you put that cream or grease on you and the menthol makes you take a deep breath, the menthol is an aerosolized compound. So you see peppermint or spearmint, you hear the word mint. Any of the mints stimulate our nasal passages. Rosemary oil comes from the evergreen tree or evergreen bush. And it is known that it can inhibit one of the steps that viruses use to infect you. There is a multi-step process. First, the virus, you have to come in contact with it, and that's called attachment. After the virus is attached, it attaches to your nasal membrane, in your mouth and throat. It'll attach on your eye mucous membrane. And that's why they're telling you cover your nose and mouth. And you'll see many people with face shields or goggles when they're known to be in contact with people infected. Because if they sneeze and you come in without eye protection, your eyes can be a portal for getting the COVID. So attachment, then penetration, then infection. Attachment, penetration, infected. If you are very aware of your body, something that we're familiar with, when you start to get a cold, you'll either get a runny nose or a sore throat, or even an influenza, you tend to have a sore throat. Even with measles, you get a sore throat. So the attachment phase of viruses generally affects the nose and the back of the throat. The palate, it gets that tickle, that kind of soreness. That is the attachment phase of the virus. What I learned when I was taking alternative medicine is we can intervene. We don't have to sit back and allow the virus to attach. And how do you stop it from attaching? One of the methods is inhalation. And if you take rosemary oil, and I put it on a folded paper towel, nothing exotic, just one, they have an eyedropper. I put a drop or two on there. Then I'll take the paper towel and I place it over my face and my nose. And I take a deep breath through the nose and take it as deep, just like you're inhaling a joint. And you breathe in deep, 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 take the towel down and blow out through the mouth. And what you will feel is a tingling, a kind of a menthol feeling going into your nose. Some people start tearing because once it hits the frontal sinuses, it'll cause the tear ducts to secrete. Well, that I would call that one inhalation. Then you would take it, same paper towel, cover the nose and mouth, breathe in through the nose. Breathe in as deep as you can, as long as you can. Just breathe, 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 breathe. And what you will feel is a tingling that moves up through the nose, and you start to feel it coming down the throat. That's sometimes a surprise to people. The nasopharyngeal is a connection between the nose and the throat. And you'll feel it first in the back of your throat. And it's that same peppermint stimulation. Blow out through your mouth. Give yourself a few minutes to just breathe regular and repeat. Number 3, do the same. Breathe in through the nose with pull, 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 pull. And now you'll feel it going up and around, and it'll start to be in the back of the throat. You really feel it. Feel like you would have drank something, but it's just that volatile compound working its way down. I usually say do a total of 5 inhalations. So it will be first at the nose, then at the sinuses, you'll start to tear. Then you'll feel it in the soft palate. Then you'll feel it in the back of the throat. But when you start to feel it go into the chest, you have come to your expected. That's what you want. What you have done essentially is you have used rosemary oil, the aromatic, to dislodge. Now I'm using the term, people would say, I challenge you to prove it. My proof is I never had influenza when I worked in the emergency room. I never got an influenza shot. My entire staff would go out with influenza. I didn't go out. So I do it anecdotally. It works. When I had a loved one I know on the front line, I called her and I told her where to buy it and what to buy and how to use it. That's how important it is to me. I talk to my loved ones. So if I'm talking to someone and you said, what can they do for themselves? You need to invest into some home remedies. That would be an old school remedy. Rosemary was one of the original medicines. So if you use it just to do an inhalation, I'd say every day. If you're out there on front lines, if you're a teacher, if you are a stock person, if you are a clerk at a grocery store, or if you're at a bank, or if you are a janitor, whoever they call the essential worker, especially my bus drivers, where you have a high possibility of being exposed, protect yourself. It's the same as washing your hands, in my opinion. What are you doing? You're washing your nasopharyngeal. And even if you got it exposed and it's trying to get in, stop it. Don't let it get there. And like I said, I would do this anytime I came in from some public, like Walmart is a good example. If you do go out, if I've had to share an area, like go into a waiting room for a car repair, and you have some people in Louisiana wear a mask, some people don't. Then I would come home, and I certainly am careful about what I do with the mask, and we need to talk about that. Then I'm careful about cleaning my hands. And then I clean my nasopharyngeal pathway. So if I had a patient, a friend, a loved one that are forced into exposure, number one thing is do not allow the virus to attach and penetrate. That would be my focus. Number two, and I don't know, I pause. You may have a question or comment.
Go ahead, number two.
Number two. Black people, my Black sisters, women, particularly the darker complexion you are and the more you love air conditioning, I can assure you, you have a vitamin D deficiency. Now you say that sure was an ugly way to say that, but it's the truth. The way in which we naturally develop vitamin D is by sunshine. We were people that worked outside. We were the field workers. We were the ones in the sun 16, 18 hours a day, particularly with the history here in America. Now that we are indoors with air conditioning and house fans, many women, and I say women, we find as we get older, there's no reason to be outside. Men may walk the dog or ride a bike. Few of my Black sisters do. And when you go out when it's cool, because we don't like to sweat. So we're not going to go out there in that sun. And consequently, if you're over 45, you are very likely depleted your vitamin D stores, because we do store vitamin D. And if you're not particularly focusing on how to get vitamin D back in your system, you will have a deficiency. So what good is vitamin D? And the type of vitamin D, if you're going to take a supplement, is vitamin D3. Make sure the number 3 is on there, because vitamin D alone will not necessarily be converted into the active vitamin D. So if you're buying the cheap stuff at Dollar Tree or wherever, be sure that it has that little number 3, because this calciferous is what you need. Why is calciferous important? It is one of the vital components in supporting your innate immunity. Remember I said you have 2 kinds of immunity? Right. If your vitamin D is low, you are unable to generate IgGs and IgMs, which are the antibodies. And I just tell you, Black folk, we may be the ones that need to have that particular system activated the most, because our other systems like asthma, COPD, and previous heart attack, that one you don't want to activate too many cellular responses because it can get complicated. You want to activate antibodies. But if you don't have any vitamin D or you're very low, your body doesn't have any choices. So you've already put yourself in a position that you're most likely to get the cellular response. And if you get the cellular response, we've just talked about it. You hear them saying things like cytokine storms and swollen lungs. So if you want your immune system, your innate immune system to be robust, you need the following things to be in your system. Vitamin D3, Sister Supplement. You can get it in a chewy form, the little candy. If you've got a sweet tooth, you can order it from Amazon, and you can go to Walmart. As long as it has that little 3 on it, you're getting the right one. What is your dose? If you know you have not supplemented your vitamin D in your life, go for 10,000 units. They will sell it for 1,000 all the way up to 10. You get 1, 3, 5. But at these times, I say max it out. Go for it. If you know you don't eat liver, and some people say, oh, but it used to be poor folk did eat chicken liver. They used to, I remember fried chicken liver was considered something good. Now, young people won't take liver under any circumstance. Liver was a great source of getting a lot of different minerals and vitamins that are neglected because it's a food we don't eat, or young people don't consider gourmet, so they won't eat it. So if you know you're not eating the foods that would bring your vitamin D, what are they? I just said liver, seaweed. A few people, unless you got a lot of money, don't buy seaweed. Now there's something called nori, N-O-R-I, which you can buy as a thin paper-like substance. If you like Chinese food, or if you like sushi, you know what nori is. So the foods that I'm naming, many people don't even consider. It's like, no, I'm not eating seaweed. No, I'm not going to eat chicken liver. So you don't have vitamin D3. So go get you some and get what can build your system up. Build up vitamin D3. The next thing, you need to have zinc. Many people saying zinc. If any of you listening to me have had a pregnancy, or you got a young girl starting her period and she faints and she's weak, and the first thing they tell you, oh, she's anemic, that's because she has low iron. So we know about low iron, but we don't talk about low zinc. Zinc is a very important mineral because in our body, most enzymes need something called cofactor. And there are certain cofactors they call them like zipper enzymes, they have all kind of exotic names. But if you don't have zinc, you force your body to use alternative pathways. And if you're already stressed with diabetes, you don't want the body trying to find and figure out how to do something else because it's lacking a component. That's like me asking you to bake me a cake and you have no eggs. Now you can go ahead and try it, but that cake is not going to be the cake I was expecting because I made you go look for something else. That's the same as your body. Your body needs zinc at this time. Zinc has been demonstrated to heal membranes. Many times if you have surgery, anything dermatological like ingrown toenail removed, or any kind of podiatry, many plastic surgeons who are doing skin surgeries, they recommend supplementing zinc because zinc helps repair tissue. So if you've got a COVID infection that's raging in your lungs, what do you need to do? You need to repair it. But if you don't have zinc available, your ability to make those repairs are very slim. So what do I send people to at a health food store? If you are Black like me and your skin color is brown like this, and you rather be in the air conditioning than outside in the sun, get vitamin D3 and get a relatively high dose, 10,000. Everybody say 10,000 is called IUs, or international units. It tends to have different configuration than if you're taking your zinc. Zinc starts like 100 milligrams or 200 milligrams. So you want to have your zinc, you want to have your vitamin D3. Those two supplements will arm your body with its necessary tools to have a fighting chance. So those would be the two biggies.
Okay. The factor of constipation as it relates to immune system and health in the overall body.
Well, when you talk about constipation, it was one time that wasn't a subject. Now you can go to grand rounds at some medical school, and that's the whole conversation. What we've learned is your biggest immune organ is your gut. Did you hear what I said? I said your gut. We used to, and any parent who's had children that say 3 to 4, well, I'll say young in that 2 to 4, when they get an earache, they get these with their little knots. There's a lot of young mothers would come when I was doing pediatrics and they say, what's with that knot? My son got a little knot behind his ear, or he's got a swelling underneath his neck. And what that was is a lymph node. And when you have an infection, the body has another cleansing system. You very seldom hear them talking about your lymph as Lymph, your lymph system. Your lymph system is a circulating system just like your blood. And I pause because most people who haven't heard it say, what are you talking about? If a woman has had breast cancer and they remove a breast, now, thank goodness, they do a better job of checking the lymph nodes. They used to take a radical amount of lymph nodes out of the woman's armpit, and she'd have this big swollen arm. I know when I was a child, I'd see a woman, one arm would be 3-4 times bigger than the other. And I would be asking, Mom, what's wrong? So she had breast cancer. So when they were doing the removal of the breast tissue and the cancerous tissue, they disrupted the lymph flow, and that allows this arm to swell and it stays swollen. Anybody who has been morbidly obese, you may see if you watch TV, some of these surgeries where they go in and they get a bypass surgery and they have these huge legs or they have these hanging down places. So is that fat? No, it is a disruption of the lymph system, and the fluid will pool in the tissue. And I know some women who've had bariatric surgery and they never got their ankles to go down. They still have swollen ankles. They've lost weight and they look more, like they wanted to, but they never had the ankles ever to go back to what you'd consider a normal size compared to their body. That's because they've damaged their lymph system. So the reason I'm going in great detail talking about the lymph system is we need to be aware of it and we need to take care of it. In your gut, you have lots of lymph nodes. They're like little BB shots, and they're all along the outer edge of the gut. If you want to think about it, ladies, think about a piece of jewelry, and you'd have little decorative diamonds or rhinestones that goes all along that chain. Beautiful. Well, in the gut, that chain would be your bowel, and your lymph nodes are along the length of the bowel. If that, and you have 22 feet, believe it or not, when we say, people say feet, yes, 22 feet of bowel, if we stretched it out from end to end, and it's all nicely packaged in the abdomen, Mother Nature does good work. Well, when you get an infection, and you'll see with many children and parents, I'm sure you've seen this, the first thing a child will tell you is my tummy hurts. That might be before he gets a sore throat, might be before they get an earache. In pediatrics, one of the leading complaints of children is my tummy hurts. And you give 1 and 2 days and they may develop chicken pox, or you give them 1 and 2 days and they develop measles, but they start with my tummy hurts. So we as adults do not pay attention to our gut, our colon. That's why we have colon cancer. What they now know, the bowel should be evacuated 2 to 3 times a day. And I know one young lady, she was a petite white female, who told me she goes to the bathroom once a week. And she was saying, what? And I said, yes, there's something wrong. If you're eating every day and you're going to the bathroom once a week, that means you are accumulating waste somewhere in your body. The body is not meant to hold on to something once it has removed all of its nutrients. So if you are going to the bathroom 2-3 times a week, you need to talk to someone, and it's dangerous to take laxatives and force stuff out. What that means when you're not constipated is, number one reason, not drinking enough water. That if your body is not well hydrated, the body will pull every available water source back in. That's why the urine will be deep yellow. That means it has concentrated that urine, trying to spare the amount of water that comes out with your urine. If you are hard stool, and they say it's like a deer pellet, or you sit on the bathroom and you read the entire magazine and you still haven't gotten relief, or you have hemorrhoids, you are not drinking enough water. That's number one cause. I can remember as children, Brother Leroy, that my mother would say, children need to be cleaned out. And we get a dose of castor oil, and I don't recommend it. Man, castor oil is tough. You take it and 30 minutes later, everything, I mean everything, even what you thought about eating will be pushed out. We had a big family of 8 children, and I can remember mom would give us castor oil doses every, if I got it on Monday, my sister got it on Tuesday, because we only had one bathroom in the house. And she knew not to give multiple children their cleansing on the same day. So there is something to be said about bowel cleansing. There's a lot of literature saying that the increase in colon cancer has to do with a lack of evacuation. And the modern American, we have to be careful because we train ourselves to have large colons. What do I mean by that? If I'm playing this video game and Mother Nature says, you need to go to the bathroom. And I say, well, I want to finish. I'm going to hold it until, okay, mistake number 1. When you hold it, you are training the bowel not to release. So as a baby will eat, and I promise you, a half hour later, you changing the diaper. Mother Nature brings it in and puts it out. Many people who are very good with exercise will tell me, oh, I tell you, Velva, I do my constitutional every morning. I get up, I go to the bathroom, I urinate. By the time I've shaved, by the time I brush my teeth, I have a bowel movement. And that's part of my wake up and get started. That's good because they're clearing the way for you to take on something new. If those of you who follow Dr. Sebi, and it was just tragic how he came back to New York and we lost him, he would advocate that being plugged up is the primary cause for all disease. That's he right. Advocated that, even constipation and all other stuff. So what was his recommendation? He would recommend fasting. What does fasting do for your body? It gives you bowel rest. That when you do not stimulate the GI, meaning you chew as your first stimulation, you start salivation. Even you can look at TV and see that Big Mac and Biggie size this, and you start salivating. That is triggering your digestive system, and it's just being done visually. When you fast, you shut down a lot of hormonal responses, and that gives your body a chance to regenerate. Just like sleep allows your brain to regenerate. Bet you didn't know that. That's why when I grew up, children got 10 to 12 hours sleep. You went to bed with the chickens, as they say. 6:30, 7 o'clock, mommy had you bathed and you were in the bed and you got up the next morning around 6 a.m. or 7 a.m. That's 12 hours. Today, unfortunately, our children don't go to bed, Brother Leroy. They're up at 2 o'clock, 3 o'clock. They're watching HBO. They're in Walmart with mommy. That is so sad because we are not allowing the brain to develop. The brain only rests when we sleep. That's when it repairs itself, but I'm getting ahead of myself. When you fast, you are allowing the bowel to rest. And that means it can repair itself. It can rejuvenate the lymphoid tissue that's resting on the outside edge of itself. And when you're constipated, it's the opposite. You have stretched the colon, the lymph tissue is displaced, the lack of moisture is not allowing the lymphatic fluids to even communicate back and forth across the wall of the gut. So constipation would be a contributor to low immune response because the lymphatic system in the gut is not free to respond.
The high blood pressure. Those individuals with high blood pressure, what are some things that they can do to minimize their condition?
First of all, when I'm talking my Black Americans, I know I'm going to say it because that was my population and it's my culture group. Many of the medicines you are being given are not your friend. I'm going to repeat. White America allowed medicines. The formulary for Black people's hypertension is suboptimal. While I was in medical school, and this is many years, I finished medical school in 1989. So it tells you what, 30 years ago. 30 years ago, we knew that the drug hydrochlorothiazide would cause people to get gout. We knew that, no question, cause and effect. The number one treatment of many Black men with hypertension is hydrochlorothiazide. It still is. Why? Because it's on the formulary. What is bad? Well, you get HCTZ. For those of you who may know it from the acronym, HCTZ is hydrochlorothiazide. It causes an increase of uric acid retention. Your body does not excrete uric acid. And when uric acid is retained, it gets deposited in your joints, and you'll have the most painful big toe. You can't wear a sock. You can't put on a shoe. I've known people say they can't stand a sheet on the bed to even rest on that foot. And that joint will swell. Sometimes it'll be hot. Sometimes it's not. All I know is totally debilitating. Can't wear a shoe. Don't want to walk. You can get gout most often in the toes. You can get it on the elbow. Few people get it in the hand. So you go to the doctor and you just describe this debilitating, painful condition. He knows what it is because he gave it to you. But what does he do? He gives you another medicine. It's called colchicine. And colchicine causes the body to excrete uric acid. Now, I know HCTZ told you to hold on to it. So now I'm going to give you a medicine that says turn it loose. Well, when I give you colchicine, it lets you turn loose that uric acid, but now you're at risk for forming kidney stones. You can get uric acid deposits in the kidney, and now you got a backache. When you urinate, it hurts like everything, especially as a man, you can't get that stone passed. So now I give you another medicine called allopurinol. Now I know you need allopurinol because you're going to form some kidney stones, because I gave you colchicine to pull out the uric acid that I knew was going to get retained when I put you on HCTZ. So when I start treating your blood pressure, look how I have compounded. You went from having a high pressure to having a retained excretable. That's what we use to urinate uric acid out. And now you got possible kidney stones and you got 3 medicines. Guess what? Your high blood pressure may have done less damage than those 3 medications that I've now prescribed. So in treating, I know there are a different reason. Other thing you need to know, there's more than one reason you have high blood pressure. You can have high blood pressure because there's a vascular narrowing. Sometimes that narrowing is due to atherosclerosis. Sometimes the narrowing is due to an injury. Like if you have an injured renal vein, your pressure will shoot up. It doesn't have anything to do with your high cholesterol or anything else. It's just because that particular vessel, when it's damaged, tells the body, help me, help me, help me. And the signal it gives off is the high blood pressure. And what we need to learn is things that offend us shouldn't be looked at as a friend. You know, high blood pressure isn't something you talk, oh man, my pressure's up. It was up again. I went to the doctor's office and it's still up. We should say, why is my pressure up? What's making it go up? Not just accept the concept that it's up and let me go get a pill and take it to bring it down. Because the thing that's making your pressure high is what's going to kill you. I don't care if I get your numbers right. It may make me feel good as a doctor, but the cause of that high blood pressure didn't go away. Did you hear what I said? It didn't go away. I made you think you were better because your numbers look good. There are extensive proof of the last 30 some years that different kinds of medicine like lisinopril, acropril, anything that ends in the pril, that was a major drug when I was in medical school, put all hypertension people on this pril. And then they started putting more than one, you can get a prednisolone and you can, but it still had a pril in it. Now, 30 years later, they're admitting that didn't affect the people that died. We kept the numbers down. The numbers look good. He came in, he was 225 over 110. I gave him his blood pressure medicine. He went down to 150 over 80. And everybody was happy. And he died of a heart attack at 55 anyway. So Western medicine makes it look good. As my dad would say, it's a whitewashed sepulcher. They're not treating the problem. They're just making the problem look less obvious. So if you're having hypertension, the first question is you need to know why. Is this due to narrowing of the arteries? Okay, if it's narrowing, why? Is it because I'm having out of control cholesterol? Is it because I have too much stress hormones? See, nobody talks about that. Many women who have hypertension is because they have too high of cortisol. They usually are obese through the breast and around the waist, and they can't lose weight or have trouble losing weight. They usually have a low thyroid function hormone, and they have high blood pressure. And if you get their cortisone levels down and you get their thyroid treated properly, their blood pressure will come under control.
Okay,
So again,
we're going to hit some points very quickly in terms of time. And person has a sore throat or feeling that they're beginning to get a sore throat. I'm going to throw out some things and you say yay, nay, or whatever. Lemon, ginger, and cayenne pepper.
excellent.
Okay.
Oh, reason I say, because most people make a tea of those three things. They will squeeze lemon in hot water. They may have even brewed the ginger for a little bit, drop the ginger into the boiling water. You don't want to boil ginger. You put ginger into the hot water. You steep it. They call steeping it. And you can put cayenne pepper, just a pinch. Doesn't have to really be so hard. What you're doing, lemon is an astringent. It will clean the mucus. It will cut back whatever that virus or sore throats like strep throat or whatever is the bacteria or virus. The lemon cuts the mucus. That means it decreases the ability of that organism to cling to the surface of that tissue. The ginger brings blood. It pulls blood forward. It's called a warming, if you want to talk about it, a holistic medicine. And ginger also recruits healthy cells. What do I mean by that? Ginger, if you are having a sore throat, it will signal the body it needs to send a cleansing team. In other words, it's like calling the fire department. It's saying, hey, we need some attention over here. That's why when people have indigestion, they can take ginger in their food and so forth. Gingers are very cleansing and warm. Cayenne pepper is a blood rescue. Cayenne causes blood to come. I watched a webinar recently where people who had chronic cold feet to diabetes, the lady recommended that you take cloth, put some Vaseline on the cloth, sprinkle some cayenne pepper over the Vaseline and place it on the bottom of your feet and put on a pair of socks. She said the cayenne pepper will recruit blood to the cold tissue. It will warm your feet. I have to try. I don't have cold feet, but I've known many senior citizens who'll just keep wrapping up and putting socks on, but that was her recommendation. So getting back to your question, cayenne recruits fresh blood flow. And anywhere there's increased blood flow, there is bringing with it oxygen and cleansing and attention to the area. So making a tea of lemon, ginger, and cayenne for sore throat is perfect. That's what grandma would do.
In terms of cayenne, putting it in food, the option of putting it in food or in a drink or smoothie or tea, or taking it in capsule form, if the desire is to increase the blood flow in the body.
Well, cayenne will trigger the bowel. If you have constipation, cayenne pepper triggers the bowel. Like I said, it recruits the blood. So many times when you look at Mexico or African foods or traditional foods, even in our Creole cooking in the South, many of the Southern states, they would say, it's hot down there. Why you put all that pepper in it? You know, if they got crawfish, you better like to lick your fingers and wipe your mouth because it burns. They season it to be hot. Certain kind of coatings on chicken and fish. Cayenne is a natural antimicrobial. You may even say it was the first antibiotic. That they took it because first we just said it can evacuate the bowel. What's good about that? If you're not constipated, your lymph system is activated. It prevents viruses and bacteria from grabbing on to it, penetrating tissue. So again, most people, when they take a cayenne in a food, what do? Nose run,
Right.
eyes tear up. You have that throat kind of situation, and it makes you do what? Drink water. So all the right stuff. It flushes, and it gives you require hydration, and it recruits blood flow.
Okay, take these one at a time. I'm giving to you a bunch. Garlic.
Garlic is
coconut,
you enlist them, then
garlic,
I'll take them. Okay.
coconut oil, and apple cider vinegar.
Garlic has been since the beginning of time. It is good for toothache. It prevents the very bacteria that can invade a tooth. It is great for digestion. It has antifungal. That's the big one for garlic. I know people that take garlic and use it on toenails and fingernails to reduce the nail kind of ugly nail stuff. I've seen people use garlic on ringworm. So garlic has a strong antimicrobial system. Coconut oil. Coconut oil is the most easily digested oil known to the human body. I'll repeat that. The most easily digestive oil known to the human body. I can go into the biochemistry and talk about all the carbons and how it's positioned, but the good thing to know is coconut oil is an esterified oil that our body knows how to chop into pieces. So when we take coconut oil, it will give itself the omega-3, the omega-6, and all those stuff you hear that's complicated. Coconut oil can fix it. The body knows how to distribute the breakdown of coconut oil to give us those nutritions. So you said garlic, coconut oil. What was your last? Oh, vinegar. Apple cider. It is so important, folks, to know the difference. I went into Dollar Tree, and for $1, I could buy a pint or a quart size of white distilled vinegar. That is not apple cider vinegar. White distilled vinegar comes from petroleum. You heard me right. It comes from oil. It's a byproduct of the petroleum. Wow. So if you're buying the white vinegar that does not say apple cider vinegar, you're buying a petroleum byproduct. I only use that for cleaning my mirrors and my toilet and my tub. I don't eat white vinegar. When you say apple cider vinegar, that means you started with the apple. And the apple was fermented naturally to generate an acid. The amount of sugar in an apple will go from sugar to an alcohol to an acid. So if you're taking apple cider vinegar, you are working with Mother Nature. And they recommend if you're obese or you're having indigestion, a teaspoon of apple cider vinegar will reverse GERD or gastric regurg. And you say, wait a minute, you just said acid, and I got acid reflux. It is a phenomenon that we see with Mother Nature. Lemon juice is an acid. You take it, it becomes an alkaline in your body. Apple cider vinegar is an acid. You take it, it becomes an alkaline in your body. And any alkaline prevents cancer. It can do all the antioxidant things that's supposed to be done. It can improve your lymph system flow. We talked about it. So whenever you are constipated or you have things like Crohn's disease or gastritis, a holistic medicine person will add a teaspoon of apple cider vinegar to whatever else they're recommending. You take it either with a tea, you can take it by itself, you can take it in a cup of warm water, but you want that alkalizing process in your body to heal your gut.
Beautiful. And the last two is this: black cherries and proper cookware to use. And I'm thinking in terms of a lot of the coated cookware that is on the market, and people, they look great. They look fantastic. So black cherries, the value of black cherries or red cherries, and proper cookware based on your experience.
Okay, black cherries is your friend. Hey guys, if you're on HCTZ, you get yourself some black cherry juice and leave colchicine and allopurinol alone. Black cherry juice will grab the uric acid and help you excrete it both by urine and by feces without creating kidney stones. So I need to say it again, black cherry, black cherry, black cherry if you're on HCTZ, antihypertensive medicine. If you're not on HCTZ and you're having prostate problems, and what does that mean? Man, you feel like you gotta go, you run to the bathroom and you stand there and just dribble, 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 dribble. And so long that you gotta go back to where people are gonna start missing you, and you run out there and you gotta go back and you go back and you dribble, you dribble. You need some black cherry juice. If it's due to your prostate being enlarged, this will help remedy that such that you'll have a stronger urine stream. And women, don't feel left out. Black cherry can help you with hot flashes. If you're in a situation where you have to leave a meeting, or you wake up at night and got to jump out of bed, or you sticking your head in a freezer or the refrigerator door because you just can't find relief, start drinking some black cherry juice or eat the black cherries. It will help to hormonally balance you. The skin of that cherry contains a very potent component that a woman who is in menopause can utilize to balance her enzyme disproportionality. So, cooking utensils. If you're buying cheap coated pans because they said it's non-stick, and 2 years later it starts to stick, guess what? You've been eating whatever it is that they coated it with. So if you're buying cheap pans, you're going to end up eating that coating. And if it's Teflon, you're asking for trouble. Breast cancer, colon cancer, chronic constipation, headaches. So what should you, if you're going to get a coated pan, you want to see it say ceramic coated. Ceramic coated. Ceramic is a form of glass. It's like your china. And they now have a process where they can actually take that silicone and they melt it so that it adheres to the metal of that pan, and you get a non-stick surface. But if you can afford those expensive ceramic coated pans, you will do better to have stainless steel. Don't invest. Aluminum has been questionable. Aluminum is cheap. If that's all you can do, is better than eating Teflon. But if you're going to buy a good set of pots and you want to go to a shopping network, since we don't go to Walmart, Kmart, and other stores thinking you're going to get a good set of pots unless it says ceramic. And if you're watching your pocketbook, buy one pot at a time. Don't try to buy 6 pots for $29.99. You are buying something you will regret. If you like to cook and you don't have the pocketbook, get one good investment. What do I mean by that? You can get a Dutch oven. Those are heavy iron. Grandmother used to have a heavy iron skillet I couldn't pick up except with both hands. An iron skillet that has been seasoned, and I hope you know what that means. I hope there's ladies out there that know. An iron skillet must be seasoned, and we can talk about that another time. But a seasoned iron skillet will give you the most beautiful fried chicken. It will give you iron for your body, where instead of popping an iron peel, cook it in an iron skillet. You'll may have the best cornbread you've ever had if you bake it in an iron skillet. So either invest in the old school stuff, that's an iron skillet, or spend some money and get a ceramic coating, or take the big leap and get a pot that you know is heavy and it has a coating on it, or stick with glass. Glass you can always cook, and it's usually sticking free. But if you're looking for a good frying pan, either pay a lot of money or go stainless steel.
Dr. Velva Bowles, please tell us about your books, how they can be accessed.
Well, the book that I wrote, it's getting to be an old time. I did a second edition. I wrote a book in 2010 called Salute a Reaction, and I revised it in 2012. It's available on Amazon, and Salute a Reaction allowed me in some ways to vent. It's sort of a 3-part book. It tells you about Black health and all of the things we mentioned, hypertension, diabetes. I talk about the limitations of the medicines Black people are given. I talk about the pharmaceutical company being $1 trillion industry. It's probably now more than that. Then I talk about the injustices shown Black people, like Henrietta Lacks. If you don't know her, she's the one gave rise to the HeLa cell. I talk about the syphilis experiment, which they want to call Tuskegee, but it wasn't. Tuskegee was a location. It was CDC and the Public Health Service that ran that experiment on people for what? 41 years. I talk about the eugenics program, which was here in the United States. And some of you will be surprised that Dr. Gamble from Procter & Gamble was one of the prominent doctors that sterilized many Black children and handicapped children. So, and the final part talks about Black farming and how that should be a direction all Black American slave descendants look at, because farming may be your solution to getting nutrient food and taking care of yourself without high risk.
Dr. Velva Bowles, we want to thank you over and over again. Once again, this is only a chapter in our series of interviews with you. And may God continue to bless you and your family. And a great salute to your grandmother for passing on the wisdom that she has definitely instilled in you. God bless you, my sister.
Thank you so much. I always enjoy it. This is a joy.
And ladies and gentlemen, brothers and sisters, when you see this video, please link it up to other of your friends and relatives. This has been a classroom, second to none. And also remember, July 4th, Minister Farrakhan gave a presentation. You want to access that and just be on your P's and Q's in terms of protecting your health, your health for yourself, for your family, and grandmothers out there, your grandchildren are too valuable for you not to be around. So stay on point. God bless you all. Thank you for looking at the Wisdom Table. Praise be to Allah.
Yeah, good job, brother Levi.
All praise is due to Allah, brother. Thank
Yeah,
you.
good job, man.
Man,
Man, that was a classroom.
that was a classroom, brother.
Yeah.